As we journey through life, our experiences shape us, and our memories become cherished treasures. So much of what we hold dear, the faces of our grandchildren, the beauty of a sunset, the words in a favorite book, is experienced through our eyes. Your vision is not just a sense, it is your primary connection to the world around you. A critical component of your independence, safety, and overall quality of life. That is why today, on September 4th, 2025, we are going to focus on this precious asset. Protecting your eyesight as you age is one of the most empowering steps you can take to ensure your golden years are lived to the fullest, filled with clarity, color, and connection. Think about your daily routine, from navigating your home safely to avoid falls, to reading medication labels correctly. Your eyesight is fundamental to your well-being. It allows you to drive, to enjoy hobbies like gardening and painting, to stay socially engaged with friends and family. When vision begins to fade, it can lead to a sense of isolation and a loss of confidence. But here is the good news. Many age-related eye conditions are not an inevitable part of getting older. With awareness and proactive care, and the incredible medical advancements available today, you have more power than ever before to preserve your sight for years to come. This is not about fearing the future, it is about embracing it with knowledge and preparation. So let's embark on this path together, exploring the challenges and solutions for your eye health. This is a conversation about empowerment and protecting your vision. First up is cataracts, one of the most common and treatable conditions. Imagine looking through a window that is becoming progressively cloudy or frosted over. It is a clouding of the eye's natural lens, the part that sits behind your iris and pupil. This clouding causes vision to become blurry, colors to appear faded, and night driving more difficult. The World Health Organization reports that cataracts are the leading cause of blindness globally, but thankfully, they are also one of the most successfully treated eye problems. Next, we need to talk about glaucoma, often called the silent thief of sight. This condition is particularly sneaky because it typically has no early symptoms. Glaucoma damages the optic nerve, the vital information highway that connects your eye to your brain. This damage is usually caused by an increase in pressure inside the eye, known as intraocular pressure. As the optic nerve deteriorates, you begin to lose your peripheral or side vision. Because your central vision remains clear for a long time, many people do not realize they have glaucoma until significant vision loss has occurred. Another major concern for seniors is age-related macular degeneration, or AMD. If the eye were a camera, the macula would be the central part responsible for sharp, detailed, straight-ahead vision. AMD is the deterioration of this critical area, affecting reading, face recognition, and fine detail vision. There are two types: dry AMD, which involves slow thinning, and wet AMD, caused by abnormal blood vessels leaking fluid. Finally, for millions of seniors living with diabetes, diabetic retinopathy is a serious risk. This condition affects the blood vessels in the retina, the light-sensitive tissue at the back of the eye. High blood sugar levels can cause these vessels to swell, leak, or even close off completely. In some cases, abnormal new blood vessels grow on the retina, and all of these changes can damage your vision. Like glaucoma, diabetic retinopathy may not have early symptoms, making regular comprehensive eye exams crucial. Understanding these conditions is the first step in protecting your vision. So why are seniors more susceptible to these eye conditions? The primary reason is the natural aging process itself. Our bodies are incredibly resilient, but over decades of use, cellular structures begin to change. In the eye, the proteins within the lens can start to clump together, leading to the cloudiness of cataracts. Think of it like machinery that has been running for 60, 70, or 80 years. Some parts will inevitably show signs of wear. Another key factor is oxidative stress. Throughout our lives, our cells are exposed to damaging free radicals from metabolism and environmental factors like UV radiation. Our bodies have antioxidant defenses, but as we age, this balance can shift, making the eye particularly vulnerable. The retina and macula have high metabolic rates, making them highly susceptible to oxidative damage, contributing to AMD and cataracts. Changes in the body's fluid dynamics also play a significant role, especially in glaucoma. The eye produces aqueous humor that must drain properly, but aging can make this system less efficient, like a slow-draining sink. The world of ophthalmology is buzzing with excitement as of 2025. For AMD, incredible progress in gene therapy includes late-stage clinical trials with one-time injections. These treatments deliver healthy genes to retinal cells, instructing them to produce therapeutic proteins that fight disease progression. In glaucoma, the focus has shifted toward neuroprotection and regeneration, with compounds that protect the optic nerve. For cataracts, the latest generation of smart IOLs can adjust their focus like a young person's natural lens. The fight against diabetic retinopathy is advancing thanks to AI-powered screening tools that detect disease earlier than human experts. New drug delivery systems could release medications slowly over 6 months or even a year. This drastically reduces the treatment burden for patients and improves their quality of life. These advances represent hope for millions of seniors worldwide. While new treatments are exciting, prevention remains your most powerful tool. It starts with what you put on your plate. A diet rich in antioxidants, vitamins, and minerals is scientifically proven to support eye health. Focus on eating plenty of dark, leafy greens, spinach and kale, which are packed with lutein and zeaxanthin, two crucial nutrients that protect the macula. Brightly colored fruits and vegetables. Carrots, sweet potatoes, and bell peppers provide vitamin A and vitamin C. And do not forget about omega-3 fatty acids found in fatty fish like salmon and tuna, which help maintain retinal function and can alleviate dry eye symptoms. Protecting your eyes from the sun is just as important as protecting your skin. Ultraviolet radiation is a known contributor to the development of both cataracts and AMD. Make it a habit to wear sunglasses whenever you are outdoors, even on cloudy days. Look for a pair that blocks 100% of UVA and UVB rays. A wide-brimmed hat provides an extra layer of defense, shielding your eyes from sunlight coming from above. This simple habit, adopted over a lifetime, can make a significant difference in preserving your lens and retina health. If you smoke, quitting is one of the single best things you can do for your eye health. The link between smoking and eye disease is undeniable, dramatically increasing your risk of cataracts and AMD. Quitting smoking at any age can halt this damage and improve your body's ability to heal. It is never too late to quit. Finally, managing your overall health is managing your eye health. If you have diabetes or high blood pressure, work closely with your doctor to keep it under control. Regular physical activity improves blood circulation to your eyes and optic nerve. These lifestyle choices are a direct investment in your ability to see the world clearly. The advancements in treatment for senior eye conditions are nothing short of revolutionary. Cataract surgery is one of the safest and most common procedures, removing the cloudy lens and replacing it with a clear artificial one. New types of IOLs are available. Premium lenses can correct multiple vision issues at once. Multifocal lenses provide clear near vision, intermediate vision, and far vision. Toric lenses correct astigmatism and can free patients from glasses. For wet AMD and diabetic retinopathy, the standard of care is anti-VEGF injections. Anti-VEGF drugs block a protein that causes leaky blood vessels, but they require frequent in-office injections. Breakthrough, longer-acting treatments. Surgically implantable drug reservoirs are tiny devices in the eye, slowly releasing medication for months. Port delivery systems can be refilled in the office, turning monthly injections into twice-a-year care, a major convenience improvement. Glaucoma care is evolving beyond drops. MIGS, minimally invasive glaucoma surgery, uses microscopic devices and tiny incisions. It improves fluid drainage and lowers eye pressure with higher safety than traditional surgery. MIGS can be done with cataract surgery. One outpatient procedure can replace the cloudy lens and lower eye pressure, treating two problems at once with faster recovery. Advanced home monitoring is gaining traction for AMD and glaucoma. FDA-approved devices and smartphone apps let patients monitor vision at home daily. Results sent directly to the doctor's office enable early detection and quicker treatment, leading to better visual outcomes and empowering patients to be active partners in their care. This technology creates true partnerships between patients and doctors. We have covered a lot of ground today, from the biology of the aging eye to cutting-edge technologies. The most important takeaway is a message of hope and empowerment. The narrative that vision loss is an unavoidable consequence of aging is outdated and incorrect. While the risk increases, our ability to prevent, manage, and treat has increased exponentially. You are in the driver's seat when it comes to your eye health. The journey begins with a simple, yet powerful, first step. That first step is to schedule a comprehensive dilated eye exam. This is not just a simple vision screening for glasses. A dilated exam allows an eye doctor to look directly at the back of your eye, the retina, macula, and optic nerve, often before you have any symptoms. For seniors, an annual exam is the single most effective strategy for catching glaucoma, AMD, and diabetic retinopathy early, when treatment is most effective. Think of it as essential preventive maintenance for one of your body's most precious systems. I urge you to make that call today. Do not wait for symptoms to appear. Do not assume that because you can see well, your eyes are healthy. Encourage your spouse, parents, and friends to do the same. Family members can help schedule appointments, provide transportation, and be an extra set of ears. This is a team effort, a collective commitment to health and well-being that strengthens family bonds. Your vision is the lens through which you experience the beauty of your life's journey. It is worth protecting with vigilance and care. Your future is in focus, and the power to keep it that way is in your hands. Take action, stay proactive, keep your eyes on a bright and clear horizon,